Good morning, wherever you are. This is Alina Park from ConferenceHype. Our segment will focus on evaluating the Google CT Foundation model for central pulmonary embolism detection on computed tomography pulmonary angiograms. From the 2026 Jul 20 edition of European Journal of Radiology. Early detection of pulmonary embolism is critical for clinical outcomes, yet existing deep learning models often fail to generalize across institutions. The recently released Google CT Foundation model, pre-trained on a large, diverse CT corpus, produces compact volumetric embeddings that may transfer to downstream tasks without fine-tuning. We evaluate a classification pipeline that pairs these frozen embeddings with 3 lightweight heads, multi-layer perceptron, random forest, and a stacking ensemble for central P detection, training on the public RSNA CTPA dataset and externally validating on the Stanford INSPECT cohort. The pipeline first reproduces the published data size, scaling behavior of the foundation model on other medical pathologies. From the 2026 May edition of European Journal of Radiology. Background: to develop and validate a non-invasive magnetic resonance imaging-based deep learning and radiomics approach for the preoperative differentiation of P53 abnormal endometrial cancer, facilitating refined risk stratification for personalized treatment planning. Methods: in this retrospective multi-institutional analysis, we examined data from 920 patients with histologically confirmed endometrial cancer who underwent preoperative MRI. Results: the automated segmentation achieved DICE similarity coefficients of 77.4%, 84.9%, and 80.1% on T2-weighted imaging, diffusion-weighted imaging, and contrast-enhanced T1-weighted imaging sequences, respectively. Discussion: the integrated deep learning and radiomics pipeline developed in this study provides a promising non-invasive approach for preoperative risk stratification of endometrial cancer. From the 2026 Jul 23 edition of European Journal of Radiology. Background: to develop and validate a combined model integrating habitat-based subregional radiomics, 3D deep learning features, and clinical variables for the detection of early-stage esophageal squamous cell carcinoma on non-contrast chest CT. Methods: in this retrospective multicenter study, the segmented esophageal region of interest was partitioned into habitat subregions via unsupervised clustering, and radiomic features extracted from these subregions were fused with deep features derived from a 3D RaySnet 101 to construct a deep learning radiomics fusion model. Results: a total of 469 subjects were included. Discussion: in this retrospective case control study, the combined model demonstrated promising discrimination and calibration for early-stage ESCC, with preliminary cross-center performance. From the 2026 Jul 23 edition of European Journal of Radiology. Background: to determine the protocol-specific frequency, extent, and anatomic distribution of sacroiliitis-like and degenerative sacroiliac joint MRI findings in a large population-based cohort. Methods: this retrospective cross-sectional analysis used prospectively acquired ship trend 0 whole-body MRI. Results: BME-like signal was present in 225,2063, women 12.1%, men 9.6%, unadjusted odds ratio 1.3. Discussion: small, focal BME-like and degenerative SIJ findings are common on this non-dedicated whole-body protocol.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 May edition of European Journal of Radiology. Background: cardiac graft rejection and allograft vasculopathy are major causes of morbidity and mortality in heart transplant patients. Methods: in a reference HT center, we conducted a retrospective cohort study of 163 patients comprising 80 HT patients and 83 age and sex-matched controls without structural heart disease, studied with a standardized CT protocol. Results: median ECVCT was significantly higher in HT patients compared to controls. Discussion: ECVCT is increased in HT patients compared to controls and associated with rejection history and CAV. From the 2026 Jul 10 edition of European Journal of Radiology. Background: body composition is a general measure of health that can be determined from abdominal computed tomography using deep learning algorithms. Methods: a study was designed to test the reliability of volumetric body composition assessment in serial CTs. Results: there were 3,376 persons with paired non-contrast and 9,103 persons with paired contrast-enhanced CT exams. Discussion: volumetric L2, L4 body composition analysis shows better reliability and validity than single-slice L3 analysis, and this may result in more accurate clinical associations with body composition. From the 2026 Jul 16 edition of European Journal of Radiology. Background: to compare the diagnostic performance of ultrasound and magnetic resonance imaging for predicting microvascular invasion in hepatocellular carcinoma using a systematic review and head-to-head meta-analysis. Methods: PubMed, EMBUS, Web of Science, and the Cochrane Library were searched to identify studies assessing both US and MRI for the preoperative prediction of MVI in HCC. Results: 5 studies with 771 patients were included. Discussion: US and MRI show favorable diagnostic performance for preoperative MVI prediction in HCC. From the 2026 Jul 8 edition of European Journal of Radiology. Background: to evaluate the longitudinal evolution of transabdominal bowel ultrasound parameters during ustekinumab therapy in patients with postoperative recurrence of Crohn's disease, and to investigate the association between ultrasound changes and clinical and biochemical outcomes. Methods: this retrospective longitudinal study included 65 patients with endoscopically confirmed postoperative recurrence of CD who received ustekinumab therapy between April 2020 and December 2024. Results: distinct temporal response patterns were observed among bowel ultrasound parameters during ustekinumab therapy. Discussion: transabdominal bowel ultrasound may dynamically reflect transmural inflammatory changes during ustekinumab therapy in patients with postoperative recurrence of CD. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of European Journal of Radiology. Volumetric analysis of brain structures is widely used to detect pathological changes in Alzheimer's disease, but it has limited sensitivity to subtle tissue alterations. This study proposes a gradient magnitude-based feature derived from the normalized gradient magnitude of the entorhinal cortex as a potential biomarker for AD detection. total of 1,422 T1 weighted MRI scans from the Alzheimer's Disease Neuroimaging Initiative were used. NGM features were extracted from the EC using Sobel filtering and beta distribution fitting. 2 classification tasks were conducted to distinguish cognitively normal individuals from those with AD and mild cognitive impairment. Model performance, with and without the NGM feature, was evaluated using XGBoost, random forest, and multi-layer perceptron with repeated 5-fold cross-validation. Shapley additive explanations analysis was used to interpret feature contributions. From the 2026 Jull 16 edition of European Journal of Radiology. Background: this prospective, single-center clinical trial evaluated the technical feasibility and clinical success of the automatic needle targeting, patient-mounted robotic needle guidance platform for CT-guided transthoracic lung biopsy under local anesthesia, incorporating an exploratory post-hoc geometric analysis of parallel artificial intelligence path planning via the ND Analyzer software. Methods: out of 31 recruited patients, 1 was excluded due to on-table lesion resolution, leaving a final cohort of 30 evaluable subjects with a median nodule size of 24. Results: the platform demonstrated a high technical success rate of 93.3% and a 100% clinical success rate, successfully harvesting adequate tissue cores for full histopathological and molecular profiling in all cases. Discussion: the robotic system is clinically viable and technically feasible for awake patients, though the AI's automated path-ranking cost function requires further refinement prior to live workflow integration. From the 2026 Jull 15 edition of European Journal of Radiology. Background: nanoplastics and microplastics are increasingly detected in human tissues. Methods: currently, NMP tissue concentrations can only be detected using post-mortem, destructive techniques, severely limiting research into possible effects on the human body. Results: while NMPs were not apparent on clinical T1 and T2 weighted scans, NMP aggregates were observed on magnetic susceptibility scans, appearing as hypointensities. Discussion: NMP aggregates are detectable on T2 * MR imaging and may potentially complicate the clinical interpretation of MR images. From the 2026 May edition of European Journal of Radiology. Background: to develop and validate a machine learning model based on quantitative parameters of dual-energy CT virtual monoenergetic images for the non-invasive preoperative prediction of Ki-67 expression status in gastric cancer. Methods: a total of 367 patients with pathologically confirmed gastric adenocarcinoma were enrolled and divided into a training cohort, 2 external validation cohorts, and a cross-platform validation cohort. Results: the logistic regression model was identified as the optimal DECT model. Discussion: the individualized model based on DECT virtual monoenergetic images effectively predicts Ki-67 expression status and provides valuable prognostic risk stratification for gastric cancer patients.
This is ConferenceHype. Stay with us, coverage continues.
for now for ConferenceHype's coverage of the May 2026 issue of European Journal of Radiology. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.